Jack, hurry up! Supper's ready. You're so slow.
I'm. Okay.
You should push your call line again. We've been waiting for those darn nurses to get here. You know what?
That's okay. It's all right.
Sure?
Thank you.
Okay, no problem. All right. Well, hopefully they get here soon.
Knock, knock. Hi, Mr. Jack. I am Angela. I'm going to be your nurse today. This is Beverly. She is a new nurse on the floor. She's going to be training today. How are you today?
I'm okay.
Okay. And who are you?
I'm his wife, Kelly.
Okay. I have your carbidopa levodopa for your Parkinson's disease. Can I get your name and date of birth?
Jack has Merrick 2/21/52.
Okay. All right. I'm just going to quick give you this medicine because I have other things that I have to be doing.
I have a question, actually, before we give him the medicine. It's okay. No, we have questions. The doctor was in here earlier. And
Well, can you just please give this to her then? Because I really have an emergency I have to attend to.
Yeah,
Okay.
no, I can answer
Sorry
your
about that.
questions.
I will be back later.
So the doctor was in here earlier and kind of just quickly told us what Parkinson's was, but he used a whole lot of big words that we just didn't understand. So what is Parkinson's?
Oh, yeah, no problem. Well, Parkinson's is a chronic progressive disorder affecting typically the fine motor function. So I don't know if you noticed, maybe your husband had kind of a resting tremor at first, like in his hand, and that can progress into what we're seeing now with his shuffling gait, and eventually it could progress into no movement at all.
Okay. So, I mean, why does he have this anyways? Like, what causes it? I mean, should I not kiss him anymore?
Well, most of the time we don't actually know what causes this disease. It is possible that like genetics or certain environmental factors could cause this, but what we do know is that there is a problem occurring in his brain where there's an imbalance between two really important neurotransmitters called dopamine and acetylcholine.
Okay.
So dopamine allows a person to control their voluntary movements, and acetylcholine is responsible for sending like excitatory messages in the brain. So in Parkinson's, there's a decrease in the amount of dopamine.
And that was the one that did what again?
That was the one that allowed him to control his voluntary movements. So, you know, as you can see, he's having a hard time controlling that.
Yes.
Yes.
So now your husband, he's in the third stage of Parkinson's disease, which is why he hasn't been able to maintain his posture really at all. And you may have noticed that he's having an even harder time walking.
Yes, definitely.
And unfortunately, because, you know, as you're told, this is a progressive disorder, he will eventually arrive at the fifth stage of this disease, meaning that he will be completely dependent. And now, again, it's difficult to say when that will be.
Okay, so dependent, you just mean he's not going to be able to walk anymore? He's going to be in the bed the whole time?
No, eventually, you know, unfortunately, he's not going to be able to do anything for himself. So that'll be something that we'll eventually have to talk about. And
so is there someone that could maybe teach us these things, like that he can't do? I mean, what does that all involve, I guess?
Yeah, definitely. We could get like our physical therapy involved or occupational therapists involved to just help him be able to perform daily functions.
That would be really nice because I love him a lot, but I have a job too, you know, and do I need to call someone in or, you know, or these things that I can learn myself?
Yeah, no, definitely. We'll make sure that we get that all taken care of before you guys go, okay?
Well, thank you very much for answering all my questions. You've been very helpful.
Yeah, no problem. Medication here for you.
Hey, Beverly, are you giving him his medication? I need to chart that real quick.
Oh, yeah, sorry. Me and his wife just got talking about his disease. But yeah.
But you're giving it now? Okay, I'll go chart it then.
Okay.
Please.
So, before we give the meds, honey, hold on just 1 second. I got some questions. I know it's for Parkinson's, obviously, but what is it doing for him?
Well, it's obviously not curing his disease, but it's just helping control his symptoms. That way they're just a little bit more manageable for him.
So, like the shaking and...
Yeah.
Okay. All right. Well, good.
Now?
So, here's this medicine for you. And also, it's important to take this medication 1 to 2 hours before eating to help increase the absorption.
Okay.
Okay?
When was the last time you ate, honey? I don't remember.
This morning.
Okay. So
Okay, so it should be okay.
All right.
Okay.
So I'm... You okay, sweetie? Do you need something? Okay.
Here, perfect, good job. Okay, so one more thing. This medication can cause something called orthostatic hypotension.
Okay.
Meaning if he's going to get up at all, I want you to grab one of us first
Mhm.
because his blood pressure could drop.
Okay.
So we want to be careful about that.
So if he does stand up with this ortho, whatever you said, what could happen?
Well, like I said, his blood pressure could drop, his heart rate could go up, he could get really dizzy, and we don't want him to fall again
Okay.
and break the other hip.
Yeah.
Heaven forbid.
Gosh,
so,
no. One is good enough.
yeah. So when we get him up, we'll just make sure that we do it real slow, okay? And we'll just have your
Okay.
feet kind of dangle at the edge of the bed. Give your body time to adjust, okay?
Mhm.
Okay.
We'll have to practice that before we go home. I just want to
Yeah.
make sure I know exactly how to do it, you know?
Yeah.
I don't want him to fall again, so.
No, definitely.
Nope.
Action.
Okay, your meal should be here anytime.
Knock, knock.
So,
Hello.
Hi, I have your dinner.
coincidence.
All right, let me face it for you. Here's your dinner. I really can't stay and help him eat it, so I hope that you can help him, okay?
I'll do my best,
All
I
right,
guess.
call, I guess, if you have any problems.
Okay, I will. Well, I hope this works. I don't really know what to do to help you, sweetie, but try putting it down on the table. That would probably be better.
Can't get it to my mouth.
Okay.
Oh.
Alright, well, I need to call someone, so. Hello? Is anybody out there? Hello?
It's not how it works.
Well, I don't know. We've never been in the hospital before. Oh, you're spilling on yourself, sweetie. Let's not do that.
I got it.
Oh, you got all over yourself.
It's water.
I know, but.
So,
Here, use this.
what do you suppose this is for?
Knock, knock.
I don't know.
Hey, did you guys call? Did you need something?
Yes, he's having a lot of trouble eating, and I just don't know what to do about that.
You know,
Yeah.
someone really should have called OT to come in. They've really got some special tools for you to eat with. So I'm gonna go ahead and take this away from you. I apologize. We'll go ahead.
I thought that
I
other
think that's
nurse
a
was
bit
supposed to
different.
call.
I'm gonna have
Yeah.
some things.
Oh, okay. That's fine. But we'll bring in something else that's easier for you to use.
That's
okay?
good. That's a good idea.
Sorry about that.
No, that's okay.
Okay.
You know,
Yeah.
who am I?
Well, I love you. I think everyone. Something that we could tackle.
Knock, knock.
Hello.
Hi, guys.
Hi.
I'm Amanda from Occupational Therapy.
Hi.
Whoa.
So I have a new and improved way for you to eat your dinner.
Those look kind of weird.
So my job as the occupational therapist is just to make sure that you can keep your independence as much as possible while having the tools to help you. So what we
Nice.
So
what we
why are these so big?
these are weighted.
Okay.
So you know when he had the normal silverware, it was kind of shaking with him.
Constantly, yes.
These will help his hand be more steady.
Okay.
Okay.
Well, so far, I mean, he
Yeah.
had the one that looked pretty good, didn't it?
And then we have a pillowcase here that we're going to use as a napkin, just so that in case you spill on yourself.
Well, I got the
We
beard,
did that
so.
already.
Right. Well, you're saving some for later with the
Thanks.
beard. And then we have a plate with raised edges, so it's easier for you to get everything on your spoon. Okay. And then we do have the cup with the lid on it.
Very good idea.
All right. Do you guys need anything else right now?
Not that I can think of.
All right.
You've been very helpful.
Wonderful. Enjoy your dinner, Jack.
Thank you.
Oh, this.
Mmm.
Get this out of the way, because I don't think you need this anymore.
Well, what am I gonna do with it?
Knock, knock.
I'm not gonna do anything. Hello.
Hi, guys. I am Nicole from Physical Therapy. I need to get him out of bed. Jack, we're gonna get out of bed and we're gonna walk a little bit. Okay?
We will.
Okay. Awesome. You're encouraged and empowered. Okay.
Oh yeah, we have this here because of his hip fracture too.
Yep. Yep. And then we are gonna get his shoes on because right now he has slippery socks on, and that's not okay.
Okay.
We want to prevent falls.
Okay.
Okay. So Jack, I need you to swing your legs around. In motion. Wonderful.
Should we remove the pillow?
Yes. I can remove the pillow. Okay. And then I need you to have your feet on the floor.
Now, they said when they got him up that he was going to get this orthostatic something or other.
Yep.
What was that again? Is that now that we worry about that? Okay.
Yep, because he was laying down, so now he's in a sitting position. So we're gonna sit here, we're gonna dangle our legs. And then do you feel dizzy at all right now?
No.
No? Okay, we're just gonna sit here for a minute just to make sure. Would you help him with the
I
shoes?
will. Okay, we'll do this one first. Should I
So-
untie these, or do you think that's good?
Has
They
anyone,
slip on.
Okay.
has anyone talked to you about what to look for in your own home?
Let's do the other one. No, I haven't really gotten anything about when we go home, so I'd be pretty clueless when we got there.
Okay, so do you live in a house that has an upstairs and a downstairs?
Just a downstairs.
Wonderful. Okay, do you have any throw rugs?
We do. I actually love throw rugs.
That is unfortunate.
Okay.
Oh, no.
I know.
Is that bad?
Yes.
Okay.
Throw rugs are a huge trip hazard.
I really don't want to get rid of the rugs, but
All of
I
our
guess.
favorite throw rugs.
I know.
Yeah.
Got them from your mother, you remember?
I really like them.
I do too.
It is they are just too much of a risk.
Okay. Well, I will do anything for your safety.
I stand now, or?
All right, 1 minute, Jack. So, this is his walker that he has been practicing with. He has brakes that need to go down before he gets up.
Okay.
And then this is going to help stabilize him. You can stand here.
Okay.
And then we're just, before he gets to walking, put your brakes off, Jack.
So pull them up. Yep. Do the other one. There we go.
He's getting really good.
Yeah, it looks
All right.
like it.
Let's go, Jack. Jack can kind of move around, he can walk. We want to keep that going.
Okay.
So, you know, I mean, you need to be careful about your hip, right? We don't want to break the other one.
We definitely don't.
Right. So, so when you get home, you know, we want to keep you walking, okay? And then PT will be in, you know, once a week to check on you, make sure everything is going okay.
Mm-hmm.
Aerobic exercise, you know how everyone's always talking about how Parkinson's is a neurodegenerative disease?
What does that mean?
It means that all like the neurons, all these like little transmitters all over your body, they're kind of breaking down.
Okay.
And they're not working as well.
Okay.
So because Parkinson's is progressively doing that, we want to kind of stop it. We're not going to cure it, right?
Okay.
That's
just gonna not slow it down or just like maintain where we're at right now.
We want to maintain and we want to slow that progression.
Okay.
So aerobic exercise can actually help with that.
Mm-hmm. Like what kinds of exercises are you talking?
Walking. We can do like a lot of arm movements. He can start moving his legs, you know.
Just bending.
Right.
Okay.
Not with weights. We're not going to do weights.
Okay.
But then kind of rotating the trunk. And then maybe eventually we can get to swimming because that's really low impact. Okay?
We don't have a pool, but we can figure that out.
You know, I mean, we're in Michigan. You're close to the lake.
True.
It's beautiful out.
Mm-hmm.
Because we don't want you to be so afraid of falling that you stop moving and then you're sitting in a chair because immobility can lead to more falls.
Okay.
Because then you're scared and then you're nervous and then you're shaking even more just because you're nervous and you shake enough with the Parkinson's, right?
You'll never walk again. And
Right.
We don't want that.
Right. So we just want to, you know, help you out as much as we can. Do you guys have any other questions for me right now?
I guess, I mean, do we need to be shown how to do some of these things? Or, I mean, just bending and twisting and that's good?
We can go over it while you guys are here. And then physical therapy will be coming to visit you at home too.
Okay, well that'll work then, if you guys are coming every
Absolutely.
week or whatever.
Yep, and then we'll do some while you're still here.
Okay,
All right, great.
thank you.
You're welcome.
Hello.
Hi, you guys are going to get discharged today, okay?
Yay.
I have the papers here. We're going to quickly go over them,
Okay.
very brief and to the point. The main issue is safety. He came in here because he fell, and so you have to be very cognizant on the safety issues that you have in your house, okay?
I don't really feel like it was my fault though. So
well-
there's some things that we could do.
Yep, you have to make sure you get rid of the rugs that are in your house.
Okay.
That is a big fall hazard, so just going to have to get rid of them. That's all there is to that, okay? Do you understand that, Mr. Jack?
Get rid of the rugs.
Yes. That's
Yes.
a very big safety hazard, okay?
Would you like to buy them?
All right, the lighting in the house is a big issue as well. You have to make sure that your hallways are well lit and you can be able to see in the middle of the night if you have to get up, okay? So maybe a night light or something in the hallway. If you don't have one, maybe a kitchen light can be on, or some kind of light should be on at all times and when it's dark out, so you don't fall, okay?
Night lights.
Also, big thing is maybe if you have a home phone, put the telephone next to the bed so he does not have to rush to get out of the bed to answer the phone.
Okay.
Or a cell phone if you have that. And then another
Yes.
big safety issue is the bathroom. Make sure that there's no slip hazard in the shower. Maybe get some non-skid rubber mats to put in your bathroom.
Okay.
Some handlebars near the toilet and in the shower so you don't fall when you're taking a shower, or a shower seat.
Kind of expensive.
There are resources out there. I can have the new nurse over here. She can help you find any resources that you may need, okay?
Is she new?
She is training right now, yes.
Oh.
Okay.
It'll be okay.
And then lastly, diet. You can adhere to a regular diet, but I heard occupational therapy gave you the silverware, right, to use. Make sure he uses those.
So we're allowed to take that home then? We don't have to buy it on our own?
Nope, you can take that home with you.
Okay.
You already put it in her purse.
You should.
Just making sure.
You should take that with you if you go eat elsewhere outside of the home as well, because it's going to be very important for him to be able to feed himself, and he's not going to be able to do that if he uses actual normal silverware.
Okay.
And unless you would like to be spilling on yourself, I would suggest putting a lid on your cups, okay? Are you following everything I'm saying right now?
Perfectly.
Okay. I think I'm done here. I just need you to sign this piece of paper. Mr. Jack, can you sign here? Otherwise, I'm going to have your wife do that, okay?
Do I sign it, Mr. Jack, or?
Your full name, please.
Oh.
And I'm sorry, I don't mean to interrupt you, but
Please do.
I talked with you about the medication earlier, the carbidopa levodopa.
Yes.
Here's just some information about what we talked about. Something that I didn't
Thank
mention is that he will get to a point
I will
where
put this in your
he
chart now, okay?
might build up a tolerance to the drug.
Okay.
This is something that we call like the on-off phenomenon. So during the on time, he might experience side effects related to the medication, like voluntary movements.
Okay.
And then during the off time, he might experience poor mobility, like even freezing at times, not being able to move. So if he builds up this tolerance to the med, then we put him on something that we call a drug holiday.
A drug holiday?
A drug holiday.
What is that? Like, do I have to decorate or anything?
No, no.
Okay.
Oh, sorry. I should explain this better. It just means that we're going to discontinue the drug for usually about 10 days.
Okay.
Okay.
Okay. So discontinue it for 10 days and go right back on it?
Yep, usually, or maybe talk with your doctor because they might end up putting you on another medication if that's not working too.
Okay.
So,
Okay.
all right. I just want to make sure you had the information, okay?
All right. So
right.
everything that the other nurse said, just
yeah.
remove the rugs. We've heard that a million times. And then just make sure the hallways are well lit. And okay. Was there anything else? What about the foods that we're giving him? Like, should I change the way that I cook? Like, when I'm serving him? Because he really likes the steak. And he likes big pieces of steak.
Yeah, no, we want to make sure that we keep things down to little pieces. And again, taking this medication, you don't want to take it with any protein.
That's good to know. Okay.
Yeah. So just cut that into smaller pieces for him. That way
He doesn't choke on it or
it's easier
whatever.
to swallow.
Okay.
And then we talked about the orthostatic hypotension. So mainly just want to make sure that you guys are safe when you bring them home. We don't want them to fall again.
Definitely not.
Okay.
Well, thank you. You've been very helpful.
No problem. Take care.
Thank
Nice
you.
meeting you.
Nice to meet you too.
Okay. Medication that we gave you will give you orthostatic hypotension.
Time to take your medicine, okay? Here you go.
Out of bed, sleepyhead. I believe in you.
That doesn't look very comfortable. We should call for a new one. Hello?